Throughout the pandemic, hundreds of thousands of scheduled surgeries were delayed to make sure that hospitals could handle the surge of COVID-19 patients. Well, now that our healthcare system has stabilized, hospitals are about to start ramping up their operating rooms and start cutting away at that backlog. But the province's investment might just be a sliver of what is actually needed.
This plan will enable Ontario's hospitals and community providers to operate at 110 to 115% capacity.
Hospitals spent many months of the pandemic ramping down their operating capacity. During the third wave, for example, Humber River in Etobicoke went from staffing 18 operating rooms a day down to just 2. Across Ontario, hundreds of thousands of surgeries were cancelled, including cardiac and cancer. With the system finally stable, the province is investing $324 million to start chipping away at the backlog.
Hospitals will be able to perform up to 67,000 additional surgeries on top of the typical volume of 650,000 scheduled surgeries per year, including plans for evenings and weekends. Over 75,000 additional hours of MRI scanning and over 60,000 additional hours of CT scanning will be enabled across the healthcare system.
According to Ontario Health, right now about 200,000 people are waiting for procedures, which is comparable to pre-pandemic levels. But because cancer screenings have been way down and many people altogether have been avoiding the healthcare system, in the coming months it is expected a tidal wave of new patients will be added to the queue.
It's not so much about looking in reverse, it's about looking forward. This investment is in anticipation that we will see more people coming through.
While the health minister would not provide specific numbers or timelines, back in May, Ontario's fiscal watchdog said it would take the province about 3.5 years to clear the backlog, which the FAO predicts could soar to 2.5 million procedures after factoring in post-pandemic diagnoses. The FAO also estimated it could cost the province $1.3 billion to get through the wait list. Another issue is staffing. Ontario Health acknowledges this is a big concern moving forward.
This is our number one challenge as we think about the system and recovery and catch up and all these wonderful concepts is supporting our healthcare workers. It's not just the hours that people were working under, it was the stress levels that they were working under. Let's get our OR nurses back in the OR doing the things they love doing, that they're trained so wonderfully to do, and you immediately start to bring the stress levels down.
Now, during the briefing today, there was no talk about hiring more healthcare workers to reach those surgery targets. The plan is to have hospitals operating at 100% capacity starting this fall and slowly ramping up to the 115% as more and more patients are looking for care.